시청자 여러분 안녕하세요.
Ladies and gentlemen, greetings. This is Prosthodontics on Friday Live, which addresses different steps of implant prosthodontic treatment in an easy and interesting manner, as well as the side effects. Today, we have Dr. Cho Young-jin of Seoul Deep Rooted Dental Clinic. Today's lecture is under the topic, we're going to help you to identify the implant in question. Greetings. Thank you for coming here. Thank you for appearing today and providing support to our program. Your lecture is in line with the implant finding service provided by Korean Academy of Oral Maxillofacial Implantology. I'm sure a lot of dentists are interested in this topic. Could you briefly explain about your lecture? Today I'm going to talk about situations where we come across patients with implants placed from different dental clinics. At times, patients come with a finished prosthesis, but at times we need to redo them. We need to understand what company and what product the implant body is. Rather than thinking of it as a lecture, I want to provide guidance as to how to find the right implant. This is something we come face to face every single day, so I have high expectations and I think it will be very interesting. I look forward to your lecture. To those watching the program from the dental site, you can participate real time via the chat to leave your questions, have them answered, and you'll be able to try your chances as winning Starbucks coffee coupons. We're going to choose best question, and the winner will receive 3 Starbucks coffee coupons. Learn about your implant prosthodontics and win coffee coupons. I look forward to your keen interest. Let us begin Dr. Cho Young-jin's lecture. Greetings, I'm Dr. Cho Young-jin of Seoul Deep Rooted Dental Clinic. Today my lecture's title is Ask Whatever, I'm going to find you that implant. This is to intrigue you in addressing a prosthodontic treatment to patients with implants that I have not placed. How to find the implant. I'm going to talk about how to discern these implants. This is in line with the implant finding service provided by Calmi, and I'm going to talk about the cases using that service. There are ways to address old implants. As a practitioner, in the past, the patients who were looking for implanted treatments had no implants in their oral cavity. At times, you need to extract in the missing area. This would be the initial x-ray. You would look at the clinical situation and come up with treatment plan and plan for a certain number of implants in a certain area. You would do surgery and go through prosthodontic phase to provide implanted prosthesis. This is the final x-ray and clinical image. In the old days, this was the general implanted treatment sequence. However, these days, the patients looking for implanted treatment or those who come with certain discomforts, it's not easy to see people with no implants. Patients may have received implant treatment in the past. For instance, they may have had multiple implants placed, some may have fallen out, or there may have been issues with existing implant. The prosthesis can be damaged or failed. A lot of patients come with these kind of chief complaints. The percentage has increased. If you look over here in the first image on the other side, it is functioning normally, but in the area where teeth are missing, there is an implant here. If I were to do treatment in number 47, I need to determine whether to provide prosthesis again for the mesial implant prosthesis. If you look at the second X-ray image, implant has been placed and the prosthesis looks normal, but probably I will need to do prosthodontic treatment again along with the sites in question. If you look at the third image, the fixed hybrid bridge prosthesis was fractured. I think I'd be able to save the implant, but the prosthesis failed. We can see these kind of situations very frequently. In my dental clinic, although I have not done surgery, maybe I would need to provide prosthodontic treatment to these patients. After having done surgery, sometimes patients move dental clinics. The implant may be okay, but prosthesis may need to be redone. Even though prosthodontic treatment has been provided, you can see that the superior portion has fractured, so it needs to be redone. In this case, among the implants placed, a few have lost osseointegration, therefore it needs to be removed, and due to prosthodontic complication, at times you need to refabricate prosthesis. Also, among the implants received, at times it needs to be removed. Overall restoration may need to be redone. If you look at the images, as shown, the implants here cannot be used, therefore they need to be removed and a full restoration needed to be provided again. Since 2000s, implant treatment has become more widespread. Implant treatment has been provided widely since about 20 years ago, and if you look at different statistics, by 2022, implanted treatment number will exceed 1 million cases annually. In 2018, if you look at the annual report from Straumann Group, in Korea, the number of patients who have received implant treatment per population of 10,000 compared with other advanced nations, the numbers are really significant and it's number one across the world. With increased implanted treatment compared with other treatment, because the number of treatment have increased, the side effects have also increased. According to Korea Consumer Agency, if you look at the complaints raised in relation to the implanted treatment in accordance with the insurance policy, the biggest is related to complications, and this is followed by the need to change dental clinics in the middle of treatment. The patient may move, leading to a need to change dental clinics, but at times the dental clinic may close. Due to many reasons, patients need to change dental clinics. Therefore, cases may arise where a patient may receive implant treatment from one clinic and then receive prosthodontic treatment in another one. I've added the poster of Saving Private Ryan because the situation is very similar if you have to pick up from whatever the previous dentist has left off. Doing prosthodontic treatment again, I think it's very similar to this movie. At times, you can just provide prosthodontic treatment again, but at times, it may require periodontal plastic surgery and may need to do regeneration procedure to compensate for bone loss. Also, you may need to place additional implant to provide accurate treatment. At times, you may have to remove existing implant and place new ones. Let me show you an X-ray. Among the images shown earlier, this was removed and implant was placed again. It was connected to the adjacent implant and prosthodontic treatment was provided. We need to know the type of adjacent implant to be able to provide a prosthesis. In this case, the existing implant was very close to the root of natural tooth, and removing this would have caused a very negative impact on the adjacent bone. Therefore, implant was placed distal to it and prosthesis was provided. In this case, the implant position was not very favorable, and periodontally it was very unfavorable. You can see the apex lesion. Implants were removed and new implants were placed. In the case of lower, the position is not very good, but the prosthesis was fabricated once again for this patient. I still recall this case. The patient received treatment in Japan and the implant was made by a Japanese manufacturer. We could not find the components. One failed in osseointegration, and as for the remaining two, abutment and prosthesis was refabricated. In this case, the osseointegration was very good, but the superior prosthesis was problematic. Therefore, prosthesis was fabricated once again. This is also a case of prosthesis refabrication. First, you need to make a diagnosis whether you'll be able to use the existing implant or whether it needs to be removed. You need to look at patient's chief complaint and any discomforts that the patient is experiencing. Using this, you need to determine whether you need to remove or use the existing implant. You need to be able to assess whether the implant position or direction is accurate or whether the screw hole can be utilized to remove the implant. The amount of bone loss should be considered. If you intend to use the existing implant, you need to know exactly what it is, from which manufacturer, and which lineup. Also, whether it's in production or whether it has been now obsolete. You need to figure out whether there is digital library or whether the manufacturer continues to provide components. If you cannot identify the implant, then you will not be able to use the abutment, and if the connection is not compatible, then unfortunately you would have to remove the implant and place a new one. At times, you may not be able to get your hands on the components, but be able to reuse the abutment and provide the prosthesis once again using that. If possible, using the existing implant would be more favorable to the patients. If you can utilize the existing implant, you need to identify what implant it is from which manufacturer. Let me share with you a simple case. This is a 72-year-old male patient in number 36. Between number 37, the marginal ridge is quite starkly different. Number 27 needed to be extracted. Number 27 was extracted and restoration needed to be provided because number 37 was extruded. The number 36 implant height is quite low compared to adjacent teeth. The marginal ridge height is not right. Therefore, I decided to provide the prosthesis on number 37. Once again, the patient remembered which dental clinic he received the implant from. So I asked the patient to find out which implant was used from which manufacturer. I looked at the x-ray and I loosened the prosthesis to check. You can see that this is an internal type implant. The abutment and the prosthesis is connected internally, internal submerged type implant. This is not a hex type, but there's a 3-lobe. It's tri-lobe structure. Internal type. When I remove the prosthesis on the abutment, you can see 3 lobes here. In 2014, the Korean Academy of Oral Maxillofacial Implantology released a booklet about what you need to know about dental implants. There's a sample database of about 112 implants. If you look over here, there's tri-lobe, and the data is similar to the case that I've shown you earlier, and it says it is Implant Easy Plus implant from Company M. This book is also in Osstem's library. Yes, this is it. Yes. As shown in the cover, there are many X-ray images of implants of different manufacturers. Therefore, it can be very helpful in identifying implants. The one that you're mentioning, it's in page 74, yes. Platform image and X-ray image are included. I think this is a very meaningful book. If you expand on the oral image, there's tri-lobe structure. I've asked the patient to get the information. The patient copied the chart. It says EZ plus from M. It's the best scenario if the patient can get the information of implant manufacturer and product name. You do not need to look further. You can just make an inquiry to the manufacturer. It's the simplest way. I've made an inquiry to the manufacturer. The product is no longer in production, but I could get impression coping and analog. Therefore, I bought them. Using implant level pickup impression coping, impression was taken, custom abutment was designed. Custom abutment was fabricated and zirconia crown was fabricated. As shown on the left, the prosthodontic treatment was completed. This is before and after treatment. Marginal ridge height is adjusted and the antagonist was restored at the same time. I took a standard X-ray image after restoration, and when you compare the image with the book, you can see that it is internal structure as shown on the X-ray image. The shape of the thread, if you look from the right, it is exactly the same. The traits of the implant, it is internal structure, and in the coronal area, the rim is slightly thicker. It is thicker than the screw pitch. And you can see the same structure on the X-ray image on the right. In the lower right, the platform image. It's also the same as the image taken from oral cavity. When you have doubts, you can compare with the clinical image and X-ray image in the book and identify the implant placed in the patient. If a patient with an implant placed from a different dental clinic comes in, how can I identify this implant? I'm going to talk about the methods to narrow down on implants. One of the most useful sites is called whatimplantisThat.com. It's an overseas site. If you go to the web page, you can see this screen. If you input information of the implant on the left, relevant data can be pulled up. Over here, you can select a company and also select information on the coronal side, such as the interface, flange, color, micro-threading, implant taper, and thread shape. If you insert these conditions, the relevant implant bodies will be selected. If you look at the company, if you don't know the name, you can choose any company. There is 3M, SB. There are many notable names like Biomed 3i, Chemlock, Brownie Mark, Astra Tech. Interface, whether it's external, internal, or unique interface. As for flange, whether there is a flange or not, the color, micro thread, taper, and thread type, whether it's reverse buttress, round, square, V-shaped. Another important structure is on the apex side, whether there's a hole, whether it's open, oblong, hole, or whether there's groove. You can choose different information. On the left, I chose internal interface with color, non-tapered body, threaded, V-shaped thread, flat apex implant. These are the conditions that I've inserted. You can see the different implants from manufacturers such as Biomed I, Dentsply Nobel Biocare. The implant products are mostly from overseas implant companies. There are partially Korean products such as that from Osstem. However, it's not updated swiftly.
일정 부분 실려 있기는 합니다만 이게 업데이트가 빨리빨리 되고 그러진 않기 때문에 우리나라 임플란트 회사의
Most of the Korean companies are not listed here. Only most notable companies are listed, and not the entire product lines are incorporated, and there's a lot of data missing. If you cannot find the implant you're looking for in the basic database, and if you want to tailor your order, you need to send various information to this company, and this website will find the implant for you. If you look at the guide on the left, you need to send these data. If you insert the data and make payment with credit card, then they find the implant. The cost is about $175, so about over 200,000 won in Korea. They find the implant for you. Second is osseosource.com. It's very similar to the previously mentioned whatimplantisThat.com. The quality is slightly different. The manufacturers, abutment connection, type, body, shape, thread, these traits need to be inserted as well. If you look at the abutment connection type, there are so many different options. Yes, most of them are external, internal, and internal octagon. They take up the lion's share, but if you look below, there's so many other options such as external octagon, external spline, internal Morse taper. There are so many different types of internal connection. Just with X-ray, it's quite difficult to specify which. Another important trait is you have to choose the implant platform color. Implant product with color coding, you cannot see it on X-ray, but clinically, if you do oral inspection, if you can provide color-coded information, it can be of great help in finding the implant. In osseosource.com, I've chosen Osstem Implant as the manufacturer and internal connection as abutment connection. When I insert the conditions, Osstem products are displayed TS2, TS3, TS3 narrow. Preet.com also provided these database, but recently when I went in, it does not open data. It just receives consultation. You can download Preet app and send an email. It can provide information as to which implant it is, and it also sells relevant components. The screen displayed is a personal blog. The blogger is a Japanese person, Dr. Tajima Kiyoshi. Used to work in AOI International Dental Hospital, Maxillofacial Department. This is a database of 102 implants, X-ray image, implant body image, and platform image have been uploaded on his blog. Partially, it is open, but to have full access, you need to pay 2,350 yen. I also did not purchase it, so I was not able to see all 102. If you look at this site, the database is pretty well made. What I want to emphasize today is the identifying implant service provided by the Korean Academy of Oral Maxillofacial Implantology. This service has been available since September 2018. First, it was a KakaoTalk Plus friend. Now, it's a KakaoTalk channel. based on the textbook, what you need to know about dental implant, there are different classification depending on external type, internal submerged type, and internal non-submerged type.
여기 화면에 보이는 이런 여러 종류의 임플란트
We have accumulated a database of different types of implant, and the X-ray and platform images are included in the booklet. So the work started in 2013. It's been about 10 years. There's a lot of implant bodies not included in the textbook, but we have been continuing to gather data. We have even more number of implant information within the database, and we are prepared to provide answers to your questions. So this is an image included in the booklet. External type implant, internal submerged type implant, non-submerged type implant. Information is included in the booklet as mentioned. Some implants have color-coded platforms.
플랫폼이 컬러 코딩
If you provide information as to what color and what structure the implant is, then it would be of great help in identifying the implant in an easier manner. A total of 112 implants have been analyzed. 27 of them are external hex, 34 internal submerged hex, 27 internal submerged unique connection, 20 non-submerged type, and 4 miscellaneous types. A total of 112 types of implant information is included in the booklet.
데이터베이스가 책자에 실려 있는 상태입니다.
Can I ask you a question? Yes. At times, you may be able to successfully identify the implant, but because the implant system is no longer in production, at times it can be very difficult to find the components. In the past, I tried to look for components related to IMG implant, but it was no longer in production. It's no longer available. It's a German implant. I reached out to Germany. In Germany, human-related systems need to maintain components for 30 years even if it is no longer produced. I hope such regulation is put in place not just in Korea, but in various countries across the world that produce implants, requiring manufacturers to maintain parts for 30 years. This is something new to me. I think it's a very good system. It will be beneficial not only to the patients but surgeons alike if we can get the parts for over 30 years, unless the company disappears.
환자들에게 굉장히 큰 도움이 될 수 있다고 생각을 하고
If such system is put in place, be it mandatorily or voluntarily, it will be very beneficial.
제가 이제 나중에
If it can be continuously provided, it will be great.
계속 지속적으로 제공될 수 있게 한다는 것은 굉장히 좋은 방안이라고 생각을 합니다.
Because we've taken a moment to entertain questions, so let's look at the chat screen. I'm sure there are a lot of questions raised. Let's look at the Q&A. I look forward to Dr. Jo Young-jin's lecture. Let's scroll down. Daily attendance. At times, you have no idea what the placed implant is and you need to identify it. In this case, how do you respond to the situation? Based on my knowledge, you use X-ray image and determine the type of implant and the manufacturer. Do you have such information? I think this question was raised early on, and I think this question was addressed as this person listened to the lecture. Yes, I'm explaining on this topic. How many implant companies can be searched? This was mentioned. I've mentioned that 112 different implants are included in the database, but actually,
말씀을 드렸는데요. 사실
even more number of implants are included in the database these days. I cannot exactly pinpoint an exact number, but given that accurate information has been provided, 95% of the time, if you make an inquiry, response can be provided.
대부분 답변을 해드리고 있는 편이다라고 말씀드릴 수가 있을 것 같습니다.
호빵맨, I hope to see you more often, Dr. 조영진. Thank you. Ammonite, it's a different company, but apart from the method provided by Harry Bio, what kind of service does the Korean Academy of Oromaxillofacial Implantology provide? This is going to be explained. I've come across a patient with implant placed from another dental clinic. The X-ray image looks okay in the case of the crown, but buccolingual bone resorption is severe and there's a bit of inflammation. What is the reason? Is this because of lack of attached gingiva? I think this is slightly off topic. I love dental. These days, we frequently come across patients who already have implants and we have to refabricate the prosthesis. If the implant itself is okay, do you solve the other issues for the patient? It's very difficult to identify the implant and to solve issues. I agree wholeheartedly. It's not same as coming up with treatment plan and placing an implant and providing prosthesis. You have to salvage the implant already placed for the patient. Unless there's excessive bone loss, and if it requires removal, or if it is not advantageous for the patient to save that implant, except for these cases, I try to save the existing implant. Yes? 룡룡, depending on the model, I think there are slight differences in crystal module. Is there a tip to differentiate by company? This is something I'm going to address in the latter part of my lecture these days. The most frequently used implant type is internal submerged type. The design, some implants have very characteristic macro structure, but in a lot of cases, the designs are quite similar. It's very difficult to determine which implant it is at the thread or apex area. As Yong has mentioned, there's very fine difference in crystal module. This will be addressed in the latter part of my lecture. Not all implant companies exhibit traits, therefore, despite that, you cannot be 100% sure that it is of certain company's implant. I wish the Dental Association produces an app where if you put in the X-ray image of an implant, the name of the manufacturer as well as type of implant is automatically classified. It would be the best. That's our ultimate goal. I think this is tough at the moment. In the end, AI will play a part, but in order for AI to be applied, the data amount needs to be significant and the X-ray image provided needs to be excellent to make this into a reality. Do well if you need to refabricate prosthesis. If there's a slight implantitis, what do? Do you fabricate prosthesis again or do you remove and place new implant? I remove the existing implant if there's about half of marginal bone loss, but if there's about half or 1/3 of marginal bone loss, it becomes harder to decide. I think this question is about when you remove the existing implant. I believe I need to come up with another lecture using this topic. If it is half, it's kind of vague. If there's no clinical symptoms and if there's no acute inflammation on the gingiva, even if there is, if it can be addressed through resective surgery, and if the prosthesis is working, I'm going to control the inflammation and I'm going to keep the existing implant. I hope you come up with a lecture on this topic. TS also has a similar question. If there is implantitis, when doing retreatment, when do you remove the existing implant? Up to what level does the bone loss need to occur? When do you place new implants? I think this is the same question. So we'll entertain more questions at the end during the Q&A session. Dr. Jo, please continue on with your lecture. As mentioned in the questions, I'm going to introduce the implant identification service provided by the Korean Academy of Oral and Maxillofacial Implantology. I'm sure some of you know it, but if you search the Korean Academy of Oral and Maxillofacial Implantology, in the past this was a KakaoTalk Plus friend, but now it's a channel now. If you search the Korea Academy of Oral and Maxillofacial Implantology channel, you can find it. There's about 1,400 friends right now at the channel. If you go to the channel, you can start a chat. If you provide the X-ray image of the implant as well as other information, the task force team will provide what implant it is based on the images provided. These chats are all questions raised by different dentists, and Kaomi has provided responses to that. You need to be a full member of the Korean Academy of Oral and Maxillofacial Implantology to be able to use the service. If you look at the examples of chat, one person has cropped the panoramic X-ray image. This implant is Osstem Implant SS2 implant. In the case of implants with specific traits, you'd be able to identify implants just with X-ray image, but in most cases with just a panoramic image, it is difficult to identify the implant. Therefore, as shown in the middle, you need to send a panoramic image as well as the radiographic image taken perpendicular to the long axis of the implant. The standard X-ray image needs to be sent in order for us to be able to identify the implant. Additionally, images of the connection, or if there's color, you need to take the image of that as well. Giving us the additional information would help us in identifying the implant quicker. If you want a quick and accurate answer, providing many information would help. In the KakaoTalk channel, the chat for identify the implant, there are 17 directors, including me. When we first provided a service in 2018, I was the IT director. Currently, I'm not the IT director. Dr. Jonghyun Park is now the IT director, and he's putting in a lot of effort. Before him, Dr. Jungmin Kim worked as the IT director for 2 years and has contributed significantly. When questions are raised, at times we know exactly what implant it is immediately. In other cases, in this chat, we discuss over what implant it is. If we come to a consensus, so we deliver the information to the person who made the inquiry. When we were providing the service, one of my associates told me that there was a Kaomi Plus friend service. This person had no idea that I was the one working on it and told me that AI must be working on this. When X-ray image was submitted, answers were provided immediately. So I told that person that we have a chat where we discuss what implant it is. So the person who brought up the topic was really surprised. As shown on the left, if you send many X-ray images, we base our decisions based on the booklet. We classify whether it is external, internal submerged type, or non-submerged type. If it is external type, we look at the size of the hex, height, platform color, and micro thread. In the case of internal non-submerged type, you need to tell us the color shape, whether it's parallel or tapered. In the case of internal submerged type, you need to tell us the coronal thickness, apical shape, micro thread, position, and size. These information are all gathered to find the right implant. This is a case where such inquiry came in. The X-ray image was very well taken. The information we can glean from this implant. You need to look at the density as well as the contrast, but if you look very carefully, the abutment goes into the implant body. This is an internal type. This is not Morse taper. It's a slip fit internal type implant. It's not gonna be internal hex. It's internal but with unique connection. The body is tapered and there is a round apex. If you take a closer look, there's micro thread. There's a very fine micro thread. Based on these information, you can utilize whatimplantisThat.com or the booklet that I've just introduced or other database. This implant is from previously LifeCore. It's now known as Keston Dental. It was found out to be Renova tapered implant, and this information was delivered. In this image, if you look at the most right implant, it's been newly placed. On the left is existing implant. The person was curious about what this implant was. Within the implant, internal type abutment is in. There's Morse taper structure here. This is a very common internal type, internal hex Morse tapered implant. On top, micro thread pitch is smaller. It is suspected to be internal submerged type implant, but there are many different variations of this type, so it's difficult to pinpoint which. More information is needed to really pinpoint what. On the top of the abutment screw, there's bevel. The bevel is among Osstem Implant's traits. Based on the overall information, we came to a conclusion that it was GS implant, which was introduced before TS implant. When we receive inquiries, even with just X-ray image or just with periapical X-ray image, some implants have very specific macro structure. Therefore, you can easily discern which implant it is from which manufacturer. BioRise implant has square thread. Bicon implant has a friction fit connection. Chemlock implant has tri-channel on top. Freolit 2 of Dentsply is very characteristic among non-submerged type. The thread is like a fish thorn. This is Zimmer's Swiss Plus, tapered Swiss Plus implant, Primaplex, Hex implant, Poimet's Atlas implant. If you see them a couple of times, it is very easy to discern them, and it's not difficult to identify these implants. When we receive these kind of inquiries, we can answer them almost right away.
가장 많이 사용되는
The most frequently used implant is internal submerged type implant, and most number of inquiries involve around this implant. In Osstem, it is a TS3, TS4, or KS implant.
타입의 임플란트라고 볼 수가 있는데요. 이런
Among Korean manufacturers, there are many types of internal submerged type implants.
판매하고 있고요.
And on X-ray image, there are many different options available. So with just X-ray image, based on the thread or taper, it is very difficult to identify which implant it is from which company. Someone earlier asked about this. The shape of thread, pitch, and coronal feature needs to be factored in identifying the implant.
그래서 그런 특징을 잘
We need to catch these different traits. The abutment screw length. Among internal type implant, the screw length differ by manufacturer and the screw head design also differ.
헤드의 디자인도 약간
Also, the size of the hex differ from 1.2, 1.28, 1.27, 1.25. The screwdriver size differs slightly. The size of the hex and other information needs to be gathered
판단을 해서
to find the implant with highest probability. There are many difficulties in doing that.
그렇기 때문에
Even if high quality information is provided, there are many similar implants. Therefore, when you make an inquiry, you need to get the best quality information and data to be able to get the answer in a more swift and accurate manner.
원하시는 그 임플란트의 재원을
The first way to get good quality information is to take image perpendicular to the long axis of the implant.
사선 사진을 제공해 주셔야 된다는 건데요. 예를 들어서 이 우측이 아니라
If you look at the X-ray image on the left only,
어떤
it is very difficult to figure out what implant it is.
반드시 이 나사선에
Therefore, you need to send an image where the thread is visible and the connection type, the screw length, needs to be visible. In order for it to be visible, you need to take image perpendicular to the long axis of the implant. Good quality data is essential. Based on the information provided, we'd be able to come to a conclusion that it's an implant from Dentsply Zybe implant. Among X-ray image, at least one image should be of periapical radiograph. On the left, we can see that it is a non-submerged implant, but the angle is very slanted and thread is not visible. We can assume or suspect a couple of implants, but it is difficult to finger point to which. On the right, it's the same. The thread shows some characteristics, but the apex area is not visible. If you can see the apex, you can see that there is a round hole, and based on the thread form, we can assume that it is an implant from Stereos. The first important thing is to take image perpendicular to the long axis of the implant so that the thread is visible. Second, periapical image needs to be taken. When we read the periapical X-ray image, there's a round apical hole. The hole needs to be parallel for us to be able to see that circle shape.
근데 만약에 90도가 틀어져 있으면
If it is 90 degrees tilted, it is shown like this. The hole here, it's the same. It has circular shape, but it is shown in radiolucent line. It's the same here.
레이디오루스트한 라인이 이 각도가
Depending on whether the radiolucent line is towards the buccal side or mesiodistally, it may be shown like the top or the bottom. The apical hole needs to be read like this. The right is the same. If you look at the right image, on top, you can see the apical hole. It is shown in translucent line. It's the same with the bottom image as well. There's an oblong hole here.
오블롱한 홀이 있는 거라고 판독을 하시면 되겠습니다. 그래서 요
In the top right, the image shows the hole. This is Zimmer's tapered screw implant. And on the left, as shown in yellow, there is a oblong hole. This is Zimmer's advent implant. Third is the quality of X-ray image, as shown on the right. If the image is blur and the quality is low, no one will be able to tell what implant it is. This image does not really help in finding the right implant. If you look at the panoramic X-ray image, at times if it shows a specific feature, you can easily tell what implant it is, but with just panoramic image, it is almost close to impossible to find the right implant. Panoramic image as well as periapical image should be sent to be able to identify the implant. If you send a blur panoramic image, it is finding out to what car it is in an image like this, or finding out what the car is with just the teaser image shown on the right. The periapical image is a very good one shown here on the case of right. From the platform to the apex, implant is shown well, and it is taken in a perpendicular manner to the long axis of the implant. In the case of left, the apex is cut off, therefore it would be more ideal if periapical image could be sent together. Fortunately, the three types of implant are shown here, even without the periapical image, with the traits shown in the superstructure. We were able to identify the implant and provide an answer. In the case of right, it is element implant from SPI implant. The implant fractured in the left is Dentsply's Astratech OsseoSpeed. In the middle is SIC Max, and on the left is Rootline from Chemlock. If the quality is good and if thread is clearly visible, and the platform is very well shown, it is more easy to find the implant. Additionally, as mentioned earlier, if there are unique traits within oral cavity, such as a slip joint connection or a third type of connection other than external internal hex, if it is color-coded or a unique structure exists, you need to take the image of oral cavity to be able to identify the implant. If it has specific traits, even without X-ray image, just using the oral cavity image, you'll be able to identify the implant. Sending such information would be of great help. Or you can also send in information like this by using driver of 0.038 or 0.05. It fit perfectly. This kind of information would help too. Additionally, information such as when and where the implant was placed could help us indeed. Information such as the origin of the implant and when it was placed could be of use in finding the implant. This is a case where inquiry was made. Even with just X-ray image, I can find the implant, but if you send in the image of a clinical photo, if you expand, it is internal submerged type implant. If you look at the clinical photo, it is not the traditional hex. Taking a closer look, as shown on the image, there's 6 lobes. It has torx structure. It has a very unique connection. This is SM submerged type from company D. If you provide additional information along with X-ray image, it would help us in finding the implant in an easier manner. Let's look at clinical cases. In August 2020, Dr. Kang In-ho sent over the case. If you look at the panoramic image on the left and periapical image in the right,
이 사진을 이제 보면 저희가 이제
you
알아볼
can
것은 일단
tell that
이 플랫폼
the three implants in the platform area, it has very similar structure. The thread shape is slightly different, but you can assume that these are from the same implant company.
칼라
It has color. It is non-submerged type implant.
보이한 바디를
It has tapered body. The one in the middle is slightly straight.
가지고 있습니다. 그리고 아까도 말씀드렸지만 이 스레드의 어떤
The design of the thread is very unique. It is reverse buttress design and pitch is quite tight, and at times there's more distance. Two different types of pitch exist. There's no apical hole. Based on the information given, I looked into the matter. This is Zimmer's tapered Swiss Plus and straight Swiss Plus implant. The one in the middle, the pitch distance is slightly further away. It is 1.2 millimeter. This is straight Swiss Plus. The one on the left and right are similar, but the pitch distance is narrower.
좀 더 작은 피치를 가지고 있는
This is tapered Swiss Plus.
임플란트 제품이라는 것을 저희가 이제 알려드렸고요. 사실 원장님들이 궁금해하시는
So the question you come to have is where and how you can get the components. What we provide is identifying which implant it is from which company. Dr. Kang In-ho
이 부품 수거
realized that it was not easy to get the right component. Therefore, the abutment that the patient had was removed and prepped.
에서 프랩을 해서 충분히 이제 보철물의 지대주로서
The dentist determined that it could be used as the abutment, and impression was taken. New prosthesis was fabricated. This case was shared by Dr. Lee Ju-hwan.
있는데요.
X-ray image was shared.
이 문의 주신 이주환 선생님께서
The implant was not used by Dr. Lee Ju-hwan. The X-ray image was of excellent quality, and we were able to immediately identify that this was IS2 from N company. This has very unique trait in the coronal area. The thread shape is quite unique. Therefore, if you send the right X-ray image, we can easily identify which it is from which implant company.
그래서 선생님께서 이제 코핑을 수급을
The dentist
인상을
ordered the coping, impression was taken, custom abutment and prosthesis was delivered to the patient. This is my case in February 2017.
사진에서 보시는 바와
As you can see in the panoramic image, the patient came in as shown. On this side, there were 2 implants, and on the other side, there were 3 implants, but 1 implant failed after 2 to 3 years.
40번대에 있는
In the second implant, in the
가 프랙처 되셔가지고
lower right, the body fractured and only 1 implant remained.
보시면 하나의 임플란트만
As you can see, there's only 1 surviving implant. I'm not going to talk about the treatment plan. As shown here on yellow, I decided to use that. If you expand the panoramic image,
익스터널 타입의
vaguely you can assume that this is external connection type. In the case of external type implant,
쪽으로 헥스가 1mm 높이를 가지고 있는
some manufacturers have 1 millimeter height in the hex area, but in general, most of them has 0.7 millimeter height. The regular type has hex of 2.7 and wide type of 3.4.
익스터널 타입의 0.7mm 하이
The implant with a 0.7 millimeter height, regardless of which implant it is compatible with Osstem's US type prosthesis.
라고 알고 계시면 되겠습니다. 그래서 오른쪽에 보이는 이런
As you can see on the right, there's color coding. The implants with height of 1 millimeter, these are available from various manufacturers. If it is otherwise, you can assume that it will be mostly compatible with regular or wide 0.7 millimeter external US implant components.
후방부의 임플란트를
These components were used to place another implant in the distal area. Because the mesial implant was external type, I used external type, and it was connected using bridge, and treatment was completed in this way. This is also my patient.
환자분인데요. 환자분은
In upper number 7 and 7, and missing area implants were placed through periodontal treatment. Overall periodontal conditions were improved. The number 36 was improved. In the x-ray, you can see the radiolucent line.
보이는 것을 보실 수가 있습니다.
It was fractured and the patient brought it in to the dental clinic. In the x-ray image, what we can tell is that this is the border between implant and the abutment.
부분이 되겠고요.
Because abutment goes in like this, it is internal type. It's not Morse taper. It goes in with slip joint. It has a slip fit connection. There is micro thread. The thread is reverse buttress thread. It is unique. No prominent implants locally matched with the description as shown here. I looked at what this implant was and I made an inquiry into the Korea Academy of Oromaxillofacial Implantology group chat room, as mentioned before. A lot of dentists helped me, and it was identified as Spider 2 from Company B.
이제 확인할 수가 있었고요. 다행히
Through my associate, I was able to get my hands on the impression coping. I took impression, made custom abutment, and made prosthesis.
이렇게 보철물을 만들었던 증례가 되겠습니다. 그래서 이렇게
This was how the prosthesis was completed.
제가 알기로는
Based on my understanding, this company continued to produce products for long term, but now it's out of service. In this case, as Professor Cho has mentioned, even though it is end of service, if components are available for long term afterwards, that would be ideal, but in most cases, that is not the case. I think it is very important for companies to provide components for long term. I've talked about many cases, many inquiries are being made to the identification of implant service.
에 대한 질문이 들어오면
When questions are around currently available implants, we feel at ease, but when inquiries involve products that are out of service, even if we identify the implant, we are unsure as to how to get the components to the right dentist. I think we need to build consensus on this issue, and manufacturers should also consider this factor.
회사들도 그런 부분에 대해서 조금 생각을 해봐야 되지 않을까 그렇게 생각을 합니다. 그래서 이제 좀 마무리를
To summarize,
내가 신지 않은
in order to provide prosthesis again for the implant that I have not placed, I think it is important whether we can reutilize the existing implant. If it is a system that I'm used to, it's not a problem. But if you're foreign to the existing implant system, we need to look at the different traits by looking at the X-ray image and clinical image. Using the many methods that I've mentioned, you need to utilize them in identifying the implant. If you cannot figure it out by yourself, you can raise questions to the Kaomi service. The directors as well as myself will consult with you and help you to find the right implant. When you make inquiries, as mentioned, you need to provide good quality periapical X-ray image. If you can provide more information involving patient's dental history or others, it would help in identifying the implant for you.
제가 이런 강의를
This service has been available for 4 or 5 years, and as I've prepared my lecture, I came to have this wish of manufacturers not making and ending production of certain implants just because of popularity. Rather being swayed by trends, I hope manufacturers stick by consistent implant systems.
가진 임플란트들이 계속 생산이 됐으면 되게 좋겠
In addition, even if implant production needs to halt for whatever reason, I hope there's a archive or digital library where the relevant information are stored.
생산했던 그런 제품들의 어떤 아카이브가 이렇게 딱 마련이 돼서 그게 이제 실물
I believe the necessity to provide treatment with patients with existing implants will increase more dramatically in the future. Therefore, if necessary, if we can utilize such database archive, it'll be of great help. We need to manage it in a structured manner.
저희가 필요한 것을 얻어서 쓸 수 있게 그렇게 시스템화가 되면 참 좋겠다 이런 생각을 하게 됩니다. 네.
This is the end of my lecture.
여기까지 마치겠습니다. 예.
It's very clinically meaningful. Thank you for the wonderful lecture. Thank you. Dr. Cho, previously we addressed some of the questions. Following that momentum, we will look at the real chat. Hat Guy 12. The size of the hex on top of the implant platform, does it differ depending on implant diameter and implant manufacturer? This was mentioned. In most cases, it is unified at 0.7 millimeters. Some manufacturers have 1 millimeter height. In the case of 1 millimeter, it is not compatible. Good evening. Even if you identify the implant, it may be difficult to find the abutment for it. In this case, you need to utilize generic abutment made by the lab or some tools from certain companies. In this case, the fit and strength and other quality issues may arise. It's a very practical question. If you know exactly what product it is from which manufacturer, you can use custom abutment provided by the manufacturer or use a stock abutment. That is the best way. If this is unlikely, there can be error compared with original product, but you cannot remove the implant body just because of it. In this case, you need to use the copy inevitably. ID Moby Dick. If there's no hole on the prosthesis, on the X-ray image, it is difficult to discern whether it is a one type or two-piece abutment screw. It is very difficult to remove the PFM bridge implant prosthesis. Yes, it's very cumbersome if there's no screw hole on the prosthesis. If it looks like the cementation type in oral cavity, I think the person is having difficulty whether it is one-piece or two-piece type, but if you take a periapical image properly, you can look at the standard X-ray image and discern whether it is one-piece or two-piece. Between abutment and abutment screw, if it is one piece, there's no gap. If it is two-piece, there is a radiolucent line. If you look at it closely, if you take high-quality X-ray image, you can identify whether it is one-piece or two-piece implant. Thank you. 1 second, please. Daily checkup. What you're explaining is private service provided for a fee. If there's a public service that receives data from implant companies and provides the collected data in a public way, that'll be better. Can't this be provided by the Korea Dental Association? Can Kaomi suggest this? I think this is a very ideal opinion. This is something not just a private company can manage, and if this can be handled by the association, that would be very ideal. Jack, is there a data where there is a summary of implant companies that are compatible? These data are privately made and summary shared, but even if it is the same type of implant, visually it may look as if it's compatible with impression coping, but if you take a precise image, the fit as well as other issues may be noticed because no product is 100% compatible with each other. Because of time constraint, we will not be able to entertain all the questions, so we will take 1 or 2 more questions and the rest will be addressed via reply. Shin8234, if there has been screw loosening for a long period, there will be wear on the inner surface of the implant, even if you tighten using new screw abutment. Screw loosening can occur Again, in this case, how can we predict the prognosis? I think this is off topic. It's about complications. This will be addressed in a different lecture. Then all. In the case of cement-type crown without a hole, if the patient comes in with chief complaint of mobility, be it due to screw loosening, hex fracture, or implant tearing, if it is difficult to remove it, how should I approach it? This is not a 100% answer, but to give you a brief answer, if there's mobility due to screw loosening, and when there's mobility due to abutment hex fracture, the tendency of mobility is different. This is not something that I can explain verbally, but if you use your fingers to move the prosthesis on abutment buccolingually, the tactile sense is different. In the case of abutment hex fracture, something may feels like it's attached and it's almost about to fall off, but in the case of screw fracture, it feels very loose. Based on your experience, you'll be able to learn how to respond differently. In the end, the same solution should be applied to both situations. I think this is really interesting and meaningful lecture. I'm writing down notes. Red Cherry 1. Is there any traits where I can differentiate the anatomical form of implant prosthesis by implant? I think the person is asking by implant type. The most notable type is non-submerged type and submerged type, internal and external types. Even in the case where you're not addressing existing implants, after placing implant, if you take a periapical image of the implants, you'll be able to discern the differences, whether it is internal type, external type, non-submerged type. With practice, you'll be able to tell the difference. That's true. Because of time constraint, we will now end Q&A session, and the rest of the questions will be addressed via the chat. Okay. A lot of people have participated in today's chat. I really appreciate it. Now we will select the best question among the questions raised in Prosthodontics on Friday. The person selected as the best question will receive 3 Starbucks coupons. Dr. Cho, can you choose the best question? I'd like to give the best question gift to ID Ryong who has raised the question early on. ID Ryong, congratulations. Coffee coupons will be sent on Monday. Don't feel too let down for not being the winner today. The chat event continues on in the next lecture as well, and I look forward to your interest. Dr. Cho, could you give a word of advice to your peers who have studied long and hard up until late watching Prosthodontics on Friday live? As mentioned, identifying the existing implant and providing prosthesis once again to the existing implant, these necessities are increasing. The need for identification of implant service has risen. We have been providing service for 4 years and inquiries are increasing. One thing I want to mention is that although I have mentioned this repeatedly during my lecture, you need to get as much information from the patient. The dental history, good quality x-ray image, and clinical image should be sent for us to be able to provide a swift and accurate answer. When you make an inquiry, please provide as much information as possible. Thank you for providing wonderful lecture despite your busy schedule and providing wonderful answers. Viewers of Prosthodontics on Friday, did you like the Prosthodontics on Friday seminar with Dr. Cho Yong-jin? I believe you were able to learn a lot about identifying existing implant and to address the relevant issues. We were also introduced to Kaomi's implant identification service, and we were able to get many meaningful tips. The questions that were not answered today will be addressed via reply in the next lecture. Professor Lee Gyubok of Gyeongbuk University Dental School will provide a lecture under the title, "Why do I always worry first when there's no hole in the implant occlusal table?" Thank you for being with us up until late. Thank you.